Hello, and welcome to today's policy seminar. I am Cecilia Fabrizio, the program lead for the Standing Together for Nutrition Consortium, a multidisciplinary group of experts in nutrition, climate change, food and health systems, gender, and economics, and we're hosted by the Micronutrient Forum. Today's event is co-organized by Standing Together for Nutrition in partnership with UNICEF and the World Food Programme, and with generous support from Global Affairs Canada and the Children Investment Fund Foundation. Together, we recently launched the Global Resilience Report, which looks at the immense challenges over the last several years and their impact on nutrition. Yet, despite these challenges, many governments demonstrated remarkable capacity to safeguard nutrition for vulnerable populations. This webinar brings you these stories of success and hope. Today, we share the findings, lessons learned, and key recommendations from the Global Resilience Report. We will begin with a brief overview of the report's findings and lessons learned, and a perspective from Global Affairs Canada. We are fortunate to have a panel with representatives from 3 countries, Sierra Leone, India, and Peru, to share their experiences, which illustrate the impact of strengthening the resilience of the systems that support nutrition. Our second panel, with report co-authors UNICEF and WFP, will discuss the recommended policy measures and investments that are needed to drive nutrition resilience. And then the Chief Impact Officer from the Children's Investment Fund Foundation will add her reflections. We will allow time at the end of the webinar for Q&A. So a few housekeeping points. All participants will be muted during the webinar, but I invite you to introduce yourself with your name, your organization, and your country in the chat. Please do use the Q&A function to ask questions and mention which speaker the question will be directed towards. So now I'd like to start with introducing Melissa Hisco, the Director for Global Immunization and Health Systems, Global Affairs Canada. Melissa, over to you.
Thank you very much. Good morning, good afternoon, and good evening. I'm pleased to join you all today to launch this important report alongside the Micronutrient Forum, UNICEF, and the WFP. The Global Resilience Report lays out clear and tangible recommendations at a critical time for nutrition. Malnutrition rates are on the rise due to an interplay of both immediate shocks linked to conflict and climate and root causes like inequality or siloed reactive systems. Data from reports like this one can help decision makers to build agile programs and systems that support the most vulnerable in times of both crisis and calm. Building resilience is challenging and it's time consuming, but we know that it'll save more lives in the long run, and it's a better investment. Countries have developed solutions that work, and we'll hear some examples today on panels. And this report offers a platform to share those successes and those lessons learned with other countries. So what stood out for me about the report? Well, it underscored the need for predictable and flexible funding to help countries to strengthen their systems, and the importance of systems being strong and flexible enough to both endure the stress of crises, but also the stress that comes with long-term chronic needs. And system strengthening is something that Canada aims to support through all of our nutrition investments. So alongside others, we've been vocal about improving the integration of nutrition into systems and providing a comprehensive package of services. This will take efforts across multiple pathways and stakeholders to support countries with the integration of nutrition into health, education, social protection programs, food systems, etc. Systems are stronger with nutrition built in. We know this, and the report makes it clear. But resilience will only last if it's country-driven and it's country-led. So Canada was very pleased when the WFP and UNICEF approached the Micronutrient Forum and Standing Together for Nutrition to collaborate on this report. It's a recognition of the impact that ST4N is making. We supported the report to help build a body of evidence available to decision makers. And we're committed to working with partners and with implementing countries to narrow the data gaps in nutrition. We want to recognize and commend the hard work of the Micronutrient Forum, UNICEF, and WFP for coming together with a very clear and united message. We also hope that readers will take insights and recommendations that are presented in the report and turn them into collective action, into policy decisions and commitments. Nutrition for Growth in France, we know, is just around the corner. And so this is a timely and an opportune moment to highlight the report's recommendations. Thank you for inviting me to mark this report launch. I look forward to the discussions today. Back to you.
Sorry, my camera was a bit slow. Thank you so much, Melissa. Now I'd like to introduce Saskia Ozendarp, the Executive Director for the Micronutrient Forum. Saskia.
Yes, thank you very much, Cecilia. And it's a true honor to speak today at this important event, together with our partners, the World Food Programme and UNICEF, and our donors, Global Affairs Canada and CIF. You heard already in the introduction, Cecilia saying that the Global Resilience Report brought some important lessons learned and stories of success and hope. And I'm happy to share a brief summary of its key findings with you. Can I have the first slide, please? Over the past few years, millions of vulnerable people have suffered from the impacts of a devastating polycrisis caused by the effects of COVID-19 pandemic, a climate crisis, an economic crisis, and new and protected conflicts that have deepened food and nutrition insecurity. And these crises disrupted the key systems, the food system, the health system, the education system, the water and sanitation system, and social protection system that support access to nutritious foods, essential nutritious services, and positive feeding and care practices for children and women. The Global Resilience Report described the impact of the polycrisis on these outcomes and highlights the experiences of different countries, offering valuable lessons on the resilience of systems to safeguard nutrition. The objectives, the report outline, and the methodology were overseen by the Standing Together for Nutrition Steering Committee. Evidence on the impact of the polycrisis on nutrition was extracted and synthesized from peer-reviewed publications and reports by global organizations, including UN agencies, using the UNICEF conceptual framework on maternal and child nutrition. For the country examples, a nutrition resilience framework was developed to analyze how key systems responded during the polycrisis and derive lessons learned. This report frames nutrition resilience at the systems level, defining it as the capacities that enable multiple systems to prepare for, respond to, and recover from crises in ways that safeguard diets, services, and practices, and contribute to equitable nutrition outcomes with a focus on the most vulnerable. The capacity of systems to respond to shocks can be described as either absorptive, take protective actions and bounce back, adaptive, adjust, modify, or change to continue functioning, or transformative, a fundamentally new system. Next slide, please. The key findings of the report indicate that despite data limitations, acute malnutrition rose significantly among women and children in the countries that were most affected by the food and nutrition crises. Acute malnutrition in women and girls increased between 20 to 25% between 2020 and 2022, and the polycrisis led to spikes in food insecurity and put healthy diets further out of reach. The quality of diets plummeted during the polycrisis, especially again for children and women, due to a reduced access to nutritious foods, reductions in dietary diversity and quality, and impacts on breastfeeding practices. Essential services for good nutrition were disrupted for millions during the polycrisis, with social protection systems particularly challenged to meet high needs. The next slide, please. However, the report also found that many countries demonstrated their ability to adapt, absorb, and transform their systems in response to the polycrisis, and in doing so were able to blunt its effect. Governments successfully strengthened and adapted food, health, water and sanitation, education and social protection systems to maintain or even expand these critical systems to protect nutrition among the most vulnerable groups. Community-based actions were leveraged to build trust, tackle misconceptions, and bring services closer to the communities where the most vulnerable women and children live. And the use of innovative digital technologies and strong coordination platforms made systems more adaptable in the face of a crisis. So we will hear more about these important positive lessons learned and the recommendations for future crises in a panel in this webinar, and I really look forward to the discussions. Thank you very much. Over to you, Cecilia.
like to introduce the panel lead, Joe Jacobson, team lead, Systems Analysis for Nutrition at the World Food Program. Joe will introduce the panel members and lead the discussion. Over to you, Joe.
Thank you so much, Cecilia. I'm very pleased to welcome our country panel. We have Patricia Velar Delgado, Deputy Director for Research and Technologies at the Food and Healthy Living at National Center for Food and Nutrition at the Ministry of Health in Peru. We have Aminata Shamir Koroma, Director for Food and Nutrition at the Ministry of Health in Sierra Leone. And we have Vena Bandopataya from UNICEF, who is our Senior Social Policy Specialist. And we're going to be asking you a series of questions because we want to hear about the experience from your different countries. So we're very pleased that you're joining us today to share experience around the use of system approach to protect nutrition in the time of crisis. And I would like to start with you, Amanita. Can you briefly describe a time of crisis where adjustment had to be made for a system to continue to function, or where protective actions had to be taken to preserve or restore essential functions of a system?
Good afternoon, good morning, everybody from all over. Coming from Sierra Leone, what we had done, our health system demonstrated the resilience in maintaining quality, essential, and routine services. The system was innovatively adapted for where we shifted from mass delivery to integrated services. I think we had also we had heads up because we had information that campaign was twinkling down. So we'd already, even before COVID, planning on integrating routine vitamin A and deworming into our routine services. So that was already at work. So the integration was not difficult from changing from mass campaign into routine services, along with other innovations that we had. It was hybrid, it was targeted, covering hard to reach areas, and using our community health workers and the other health workers in the system to make sure we increase coverage. Because even before COVID, routine services was like very low. Unless we do mass, that's when we'll get our coverage. So we had already thinking on how to increase routine before COVID. And the integration of VAS into the health platform and into other integration like immunization, WAC. What we did, we coined what we called the 6 monthly contact point, because we started vitamin A at 6 months. And it's at 6 months that we also do complementary feeding and family planning. So we said that 6 months is a very important milestone for the child. It's kind of that one-stop time when the mother comes, vitamin A is administered, family planning, and complementary feeding also. So I think with this innovation, it really helped us to maintain, to even increase our coverage of vitamin A during the COVID system, during the full COVID times. So for us, even though it was a trying times for us at COVID, but just the integration, the innovative integration of the vitamin A into the routine system helped us to our coverage for vitamin A.
Perfect. Thank you so much.
I thought you were not getting.
No, we can hear you. We can hear you perfectly fine. So maybe let me then ask the same question to Patricia. Patricia, could you also tell us about the experience from Peru and explain how you might have had to make adjustment for a system to continue to function or take protection actions to ensure that the function could be preserved?
Hello, good morning. During the COVID-19 pandemic, the social program had to update their care modalities and adopt a systematic approach in action for food security and nutrition. The distribution of fortified rice as a part of the food basket was prioritized as rice as an essential part of the Peruvian diet, and fortification ensured their increasing nutritional value. Before the pandemic, social programs have begun incorporating fortified rice during the crisis. Its coverage was expanded, and after the crisis, it was consolidated as a mandatory component. Then, the school meal program, Caliwarma, was adapted to continue to provide nutritional food to school children in the form of take-home ration when school were shut down. In addition to the school population, Caliwarma temporarily expanded to support subnational government in areas with high poverty prevalence for the provision of food baskets to vulnerable populations. On the other hand, Cunamas, a national program targeting children under 3 years old, adapted for the provision of food in daycare centers to take home food basket for consumption at home. The program was also able to progressively incorporate fortified rice within the ration. Today, Cunamas program ration include fortified rice throughout the country. Finally, families affected by the pandemic and the food crisis organized communal pots, we name in Spanish ollas comunes, as a response mechanism to the emergency. The national government includes this organization in the Caliwarma program through subnational governments and provide food assistance for their operation. Thank you.
Perfect. Thank you so much, Patricia. And Mr. Winner, if I could also ask you to describe the actions that was taken in India to respond to the polycrisis.
Mr. Vina, are you there?
Yeah, I'll try to.
Maybe you could start the follow-up questions.
Okay, so I will go ahead with the second question. So I'll come back to you, Amanita. You're saying that you leverage the 6 months contact point. Can you tell us do you think were the key factors in your efforts in Sierra Leone that contributed to the success of this approach?
Thank you. What we had been doing, apart from the community health workers, we also have what we call the mother-to-mother support groups. And these groups, we have a lead mother, experienced mother, working with between 10 to 15 inexperienced mother in the community. And this, we think, these support groups are very close to the household. And what we also did, what we had done before, we had trained mothers, every mother in the community, on the use of MWAC. So because when we had Ebola, it was no touch. We had a no touch policy for growth monitoring. So we had started training mothers, and every household had MWAC tape in their possession. And with that, we had a lot of sensitization. So with the mother-to-mother support groups at community working very closely with the community health workers, we were able to also increase sensitization on VAS and the woman. So this also helped us because we've also started integrating VAS into the routine health system, because we had information campaign was shrinking down and we needed to make sure to increase coverage so we don't have that deep dive in reduction in coverage. So we had started working there. But with the mother support group and the community health workers and the health facility workers, we were able to maintain the coverage. We were even able to increase vitamin A from 26% to 32% from 2019 to 2021. So I think for us, that was what really helped us: the community intervention, the sensitization, and the mother support group, because it was very difficult for health workers to go out in the community, and then mothers were really not accessing. And then community health workers were also in the loop in administering vitamin A in the very hard to reach areas, because most of the areas it was very difficult for the mothers to access the health facility. So I think that was what really helped us being innovative before even the crisis. We were working on these innovative strategies. So when we had the crisis, we just continued, and that really helped us not to reduce our coverage drastically during the crisis. Thank you.
Thank you so much. I mean, that's a great example, and really sounds really like a successful approach. Thank you so much for sharing that. Patricia, can I also ask you to share your thoughts on the same questions? You were saying, you're talking about how rice fortification were already in place before the crisis, and how you used the school feeding program to also expand the coverage of distribution of fortified rice during the time of COVID. What do you think was the key success factors that contributed to making this approach a success?
Okay, thank you. A systematic approach to food security and social program was prioritized. Multi-sector and multi-public and private actor platform and action facilities and strengthening the adaptive capacity of social protection system in our people. Social programs were slightly able to adapt their transfer modalities with coordination with private actors to ensure these adaptations could be implemented accordingly. The private sector had the capacity to increase the available of fortified rice to meet the growing demand during the crisis. Production capacity before the pandemic had been strengthened to meet the institution demand from social protection programs. During the pandemic, private actors showing the capacity to expand their operation, and they were responding the growing demand even before the pandemic. Okay.
Thank you so much, Patricia. This is also a really impressive example. I'm going to jump back to Patricia. Sorry, to Manata one more time. And I wanted to, you already touched on it in your previous intervention, but I was wondering if you could describe for us the impact of the approach that you used in Sierra Leone. Aminata, could you please describe for us what was the impact of the approach?
Sorry. Thank you again. What we saw was in 2019, we were 26% coverage of vitamin A. Mm-hmm. And at 2020, it rose to 32%. Like we said, and further to 66% in 2021. So it was increasing. And even up to date, we're still using the 6 monthly contact points. because for us, we realized that integrating into other services was the win-win for us to increase our coverage, especially when we integrated with the EPI program, we integrated with family planning. And this is when, at that point, it's like a one-stop shop for the mother when they come to the facility. That's the time we do a vitamin A supplementation, and then family planning and immunization. So it became a program for us in nutrition in our directorate. We have that now 6 monthly contact point. All the health workers were trained, the mother support groups were trained, and then our community health workers too were trained. So because that had worked very well during the crisis, we still maintain it. It's now part of the health system, the 6 monthly contact point. And with this also, it's also growth monitoring. The mothers now, they have the MWAC, they use the MWAC so that before the child gets to the point where the growth starts faltering, they are now sensitized to go to the health facility. So we saw tremendous impact and improvement for even during that hectic period for us. It was rising, and we're still working on that, because right now we also integrated outreach services and hybrid. So sometimes when we look at the data and see that there are areas that are really falling behind, we'll go in and mop, because mass is no longer. And then the other thing that we also did was, because malaria program was still doing mass distribution. So we'll go in and integrate with malaria whilst they're distributing. We're also sensitizing the household and also giving vitamin A and deworming. So that really helped us not to really deteriorate and reduce our coverage. It reduced from 19, from 26 to 32, and eventually to 66 in 2021. And we're still using a 6 monthly contact point. We're still using the outreach. We're still using the hybrid points. We're not doing mass campaign anymore.
Excellent, excellent. I'm wondering, so with these positive results, have there been any implications on policy to respond to future crises?
Well, yes. Right now, like I said, the 6 monthly contact point is part of the routine policy. And then the community health workers are also involved in vitamin A administration. And then the mother support groups are sensitizing. And now we know purely it is routine. So we need to it's a must that vitamin A is integrated in any of the health services that we give. Right now, we have Mizu Rubella campaign. We're integrating vitamin A into the campaign. We go to the areas that are really low in coverage and also make sure vitamin A is distributed. So the integration came out to be very strong, and that it is working. And this is a way to go for us to also use the minimal resources that we have to continue to improve services. So yeah, before, integration was not as where it is today, but right now everybody's improving on the integration. So the policy really now is to make sure people work together. We cannot work in silo. We need to integrate services, because it's the child, and the child is at the center. So now it's child-centered services that we're doing.
Perfect. Thank you so much. And then before we round up, I just want to ask also, Patricia, if you could also briefly describe the impact of the program and whether it had any policy implications.
Okay. Due to the pandemic, health facilities prioritized care for COVID-19 case, which affected the distribution of nutritional supplements. Fortified rice became a strategic food due to its micronutrient content, ensuring nutrition needs were continued to be met. In 2019, pre-pandemic, COVID, 2.5 million users were served with fortified rice as a part of the Kaliwarma school feeding service. Care coverage with fortified rice during the COVID-19 pandemic has a significant increase to 3.2 million school children. Additionally, fortified rice was incorporated into the care package of users of the CUNAMAS, is another program, national program for children, around 6,000 children under 3 years of age, and the care package of 215,000 users of common pots, named in Español, ollas comunes. With this, the total number of users served with fortified rice reached around 3.5 million Peruvians. In this way, favorable conditions were generated for the approval of the rice fortification law in Peru in 2021. Today, the government, with the technical assistance for the World Food Program, is working to reach mandatory and universal rice fortification for all the people in Peru. I think this is the impact for the fortified rice, and to dismiss the impact of the crisis.
Thank you so much. Thank you so much, Patricia. And thank you so much, Aminata, for these really insightful experiences from your countries. I think that there's a lot of different things that you are highlighting that were important for the success, but there's two things that I think are essential that are standing out for both of the different examples. Firstly, it seems to have been really important to ensure that ahead of the crisis, that you actually had the right programs and policies in place to allow you to respond in a timely manner. And secondly, also that you've been able to leverage different systems and delivery platforms, also at community level, to ensure that you were able to reach the right people with healthy and nutritious diets, as well as essential health services. Before I'm handing back to Cecilia, of course, I would like to thank you so much for sharing your experiences, but I also want to say to the people online that there's going to be an opportunity to ask questions to Patricia and Aminata at the end, at the feedback session, and that the case studies from Peru and from Sierra Leone and from India are all included in the report. So you can also go in and look at the report to get more details on this. Thank you so much for sharing your experiences. And back to you, Cecilia.
Thank you so much, Joe and esteemed panel members.
May I come in? I'm sorry.
Yes.
May I come in? I'm sorry, I was away. I think my name was called. I was away for practicing. So same thing. So so when it will start? Is it 1 hour more we have, or what?
Ms. Vina, yes. We're live. We're in the middle of the webinar right now. I'm wondering if maybe we can come back to you during the Q&A session and ask you the question. So people will have an opportunity at that point. So we're going to move on to the next panel, and we will come back to you in about 20 minutes. So thank you. Sorry about the confusion, some technical difficulties. We'd now like to introduce our second panel, who will be moderated by Nita Dalmia, the Senior Nutrition Advisor at UNICEF. Nita will introduce the panel and lead the discussion. Over to you, Nita.
Thank you so much, Cecilia, for the introduction, and greeting colleagues. So as I was listening to the country panelists about their experiences in building resilient nutrition systems, I was thinking about the important policy and program lessons they offer, especially in the current context of conflict and climate change. So in this panel, we'll hear from our panelists about how these experiences are shaping global advocacy, policies, and strategic approaches to accelerate country progress towards the nutrition SDGs. So now I'm pleased to introduce our two panelists, Victor Aguayo, Global Director of Child Nutrition and Development at UNICEF, and Abigail Perry, Director of Nutrition and Food Quality Service at the World Food Programme. So starting with you, Victor, based on these lessons, what policy measures and actions would you suggest UNICEF advocates for to expedite country-level progress towards the nutrition SDGs? Over to you, Victor.
Thank you, Nita. Thank you very much. This is a very important question, actually. But first, if you would allow me, I would like to acknowledge the collective work of standing together for nutrition, of course, UNICEF and WFP in producing this report on global nutrition resilience. The report is important, in my opinion, given these never-ending threats to child nutrition in the world, especially among children affected by growing inequities, growing conflict, and of course, the climate crisis. I'm also very glad to hear from our colleagues from Peru and Sierra Leone about their success in building resilient systems for nutrition. And of course, I'm very pleased to be in this panel with my fellow director and friend, Abby Perry from WFP, with whom I work very closely. So let me start, as I often do, with good news. In fact, very good news that I think we all need to be aware of. We all need to be aware of that in the last 3 decades, that is between the year 1990 and the year 2020, we collectively have been able to reduce the prevalence of child undernutrition by 45%. The number of children with stunted growth and development because of malnutrition by 110 million. This is despite very significant population growth. So it means that positive progress for nutrition not only can happen, but is happening across countries and across regions. And the testimonies we just heard from Peru and Sierra Leone show that the benefits of building resilient systems to protect child nutrition from the threats that we have been witnessing over the last years. However, we also need to recognize that there is still very significant work to be done. Our most recent report, the UNICEF report on childhood poverty, shows that we have about 181 million children under 5 living in severe childhood poverty. These children, 1 in 4 children under 5 years of age, are deprived of the nutritious, safe, and diverse foods that children need to grow and develop to their full potential in early childhood. Therefore, we need to consider the reality of increasing socioeconomic disparities and inequities, increasing conflict, sometimes chronic, sometimes acute, and of course, climate shocks and the climate crisis. And in this context, UNICEF remains committed to strengthen nutrition delivery systems in the countries where we work and ensure that nutrition delivery systems withstand the shocks and protect child nutrition from early childhood onward. So I see 5 key priorities that we need to advocate for. First, we will advocate to position the elimination of child food poverty and malnutrition as a political and policy imperative, and the reduction of child food poverty and child malnutrition as a metric of success towards national and global development goals. So advocacy at the highest level for the elimination of child food poverty and malnutrition. Second, we will advocate for the transformation of food systems to ensure that food systems make nutritious foods the most accessible, the most affordable, but also the most desirable option for children and families, and that the food and beverage industry complies with policies to protect children from unhealthy foods and beverages. As we heard from Sierra Leone and Peru, we also need to leverage health systems to deliver essential nutrition services to prevent and treat child malnutrition, including through community-based programs and services to improve nutrition during pregnancy and early childhood. Community-based action has been of the essence in maintaining and protecting the nutrition situation of children and women during the more recent crisis. We need to activate, as we heard, social protection systems to address nutrition deprivation in ways that contribute to improve the quality of the diets, the services, and the practices for the most vulnerable children. Those are the youngest, the poorest, the children left behind by mainstream development, conflict, and the climate crisis. And finally, we also need to strengthen data systems at any point in time. We need to know the extent and the severity of child food poverty and malnutrition. We need to be able to assess trends. We need to be able to assess progress, but also detect setbacks as soon as possible in child food poverty and malnutrition, including in fragile and humanitarian contexts. It is strengthening these nutrition delivery systems that will make nutrition resilient in times of crisis. These actions, when they are supported at scale with governments and through governments and partners, have the potential to keep us on track towards the SDG targets for child nutrition and development. So I'll give it back to you, Nita, and we hear from my fellow panelist, Abby Perry.
Thank you so much, Victor, for sharing the important policy and program actions that UNICEF is going to advocate for. So moving on to you, Abby. Considering the impact of climate change on already vulnerable countries and populations, especially girls and women, how can we apply these lessons to safeguard nutrition and address gender inequality? Over to you, Abby.
Thank you, Nita, and thanks very much to the Standing Together for Nutrition team, and indeed with our collaboration with UNICEF for producing this important report. I think I first started talking about the concept of nutrition resilience back in 2011-12, and the fact that many more people are interested in the concept now is gratifying, although it is gratifying in the context of an increasingly challenging world, so maybe also a little bit disheartening at the same time. When it comes to the areas that I think it's really important that we're thinking of moving forward to really think about this kind of nexus around nutrition, the climate agenda, and gender inequality, there are a few things that come to mind, and it builds nicely, I think, also on the areas that Victor noted as well. So first, just to underscore the importance of data and analysis. I think we're seeing, a revolution happening in terms of our ability to better predict and better understand how climate change is going to affect populations, and indeed is affecting populations, both in terms of the extreme weather events, but also the long-range impacts in terms of the nutritional quality of food, implication for disease outbreaks. And we absolutely need to really major investments in how technology and data, AI, all the things that we have in front of us can help us better understand who is most affected and how and why, and indeed when. It's going to take a much more nuanced approach, I think, to be able to ensure that the support that we need to provide gets to the right people at the right time. But we do have the power and tools in front of us, which I think we haven't yet harnessed sufficiently in the nutrition sector, but very definitely need to. I think the second area, just building on Victor's comment about the importance of social protection, I absolutely agree. I think this remains a very, very fundamental policy and programmatic instrument to enable governments to really try and more efficiently and effectively address the needs of populations that are facing climate crises. But again, I think this question of ensuring that those mechanisms do reach and support and empower women as well as children is really, really key, but also to ensure that they are increasingly adaptive or shock responsive. So again, that we have more efficient and effective ways of being able to scale up or scale out support that can help protect people facing the greatest vulnerabilities in the face of climate change. I think the third area that I really want to highlight is this question of how we can also really harness investment and action to ensure that nutritious, healthy, safe diets can actually get closer to the people who are furthest behind. We still see a really big gap in terms of the nature of technology, solutions, innovation, financing that really can actually invest in areas that can enable food solutions to reach those in greatest need. There is a growing level of investment in this kind of area, but it's not always done in a particularly joined up way. And this is something that as the World Food Programme, with FAO and IFAD and others, we're really keen to see how we can make sure that we're transferring more of that tech innovation and investment towards the areas of the world that need it the most to better access healthy and nutritious diets. And the final thing I really want to note is that we really do, I think, need to pair up a little bit more with our colleagues who work on gender empowerment and really looking at the transformative actions that can enable women to have a path forward that enables them to have much greater voice, agency, control over resources. I still think that's an area for nutrition that is a little bit of a weaker side of ours. Women play a really important role in the world, but we also need to make sure that they have a fair and equal role in the world, and the responsibilities around childcare, household duties and so on, alongside all of the work that women do in terms of earning money, doesn't result in them ending up with more work and more responsibilities to help protect and support good nutrition, but they're able to benefit from kind of a fair and equitable world moving forward. And we need to we need to learn from the gender experts in that respect. Underpinning all of this, of course, there's a big shift that's needed in terms of financing, and we talk about it a lot in terms of the quality, nature, predictability, but we really need to act on that. The fact that, as many people will note, of all the climate financing that exists, the vast majority goes to climate mitigation, and the small amount for climate adaptation that offers us a really important chance to shift the dial in terms of food systems for nutrition in these contexts. Very little of it goes to the most fragile settings. How do we shift that kind of financing landscape to enable governments and others to be able to really sustain the systems investments needed in this space? So I'll hand back to you, Nita.
Thank you very much, Abby, for sharing the key actions that you see that WFP will support. You mentioned a number of points that are common across UNICEF and WFP, including a really important point about transforming nutrition systems to better safeguard the food and nutrition rights of girls and women, and also the financing point, which I think is going to be so important as we lead up into the Nutrition for Growth Summit next year. So I'd like to thank Victor and Abby for sharing their insights about how to apply these important country lessons learned in building nutrition resilient systems. And back to you, Cecilia.
Thank you so much, Victor, Abby, and Nita. I'd like to now ask Anna Habokian, the Chief Impact Officer and Executive Director, Nutrition for SIF, to provide some reflections on the report's recommendations. And then just a highlight and request, Joe and Vera, we're going to turn to you for a quick question after this to kick off the Q&A session. So over to you, Anna. Thank you.
Thank you so much, Cecilia. And may I just start by congratulating, first of all, our colleagues at the Micronutrient Forum, the Standing Together for Nutrition, UNICEF and WFP for releasing this very timely and important report. My colleagues already touched at the end of the last panel session on the importance of financing. And indeed, as a community, we need predictable and sustainable financing to meet the growing financing gap for nutrition, which is in billions per year. We have the M4G coming as an opportunity to replenish the commitments from governments, both in donor countries and also domestic governments, importantly. And some of the ways in which we could make the dollars go further is exactly relevant to the threats highlighted in this report. It's all about integration and looking across the systems and across the sectors. We all know that families and communities do not live their lives in silos. Often the same child that needs vaccination also needs access to RUTF and SQLNS. But the way that development finance flows have been arranged historically gives the impression as if they do. You know, financing and services for vaccines are done here. For SAM and RUTF are somewhere else. For deworming are elsewhere. We really need to integrate much better across health, nutrition, climate systems and services. It has been encouraging for us as a foundation to see some of those really positive integration efforts emerging. For example, we've been very excited to partner with Gavi and with UNICEF, the Child Nutrition Fund, to really test at scale integrating immunization and severe acute malnutrition prevention services. And we would like to see more of those, and we hope the community would welcome those efforts for more integrated service delivery and financing. And lastly, while the costs for sustaining the efforts on nutrition are quite clear, and we're having more and more quite well-aligned costing estimates coming out of the global community, I think we probably underestimate the value of also talking about the benefits of nutrition. And it is really important to highlight that the socioeconomic benefits of investing in nutrition are in double digits. And when we go as a community to raise more funds, more support for nutrition, including at the Nutrition for Growth Summit, I think we should be proudly talking about the immense benefits of investing in nutrition. Thank you, everybody. And again, it's a really pleasure to be here with you all.
Thank you so much, Anna. We really appreciate all the contributions here. I'm going to, we can now start the Q&A session, but I want to first invite Joe and Miss Vera to really highlight the impact and the work that India did. Again, appreciation. We know there's been technical difficulties, so we appreciate your contributions. Ms. Vera, are you able to turn your video and sound on, please? If you're able to turn it on, please turn on your video. Oh, great. I hear the audio. Great.
Yes.
Okay, over to you both.
First of all, thank you, everyone, and thanks all the colleagues for providing this opportunity, which is immense. And I'm very sorry that Secretary could not join because of very critical meeting with Prime Minister's office, since it is new government. Coming to very briefly about India leveraging multiple systems of social protection and health and education to deliver on nutrition agenda and safeguard nutrition during COVID crisis. Since time is very little, I would like to highlight only few things. One is that India, you all know that India's social protection system, especially social protection for nutrition system, is backed by a very robust rights-based framework, which is right to food is a recognizing right to food and income is fundamental right, which is ensured through food assistance program and through wage employment program. The multiple system was possible to leverage because social protection program cuts across all the ministries through health, through education, through ICDS, and as well as school and other social protection assistance program, such as public distribution system and food transfer program. So this itself, during COVID, technology enabled and technology was used to deliver all these benefits through cash and kind assistance, and bringing many kind program converted to cash program for efficient delivery to the last mile, which was excellent and helped government of India to reach the last mile immediately. India has largest network of women and self-help group and community health worker, ashas, anganwadis, and teachers, which were immediately capacitated and also supported through through very innovative approaches, through motivational program, and also providing health insurance and other social security benefit to community workers like ashas and ANMs, which helped them going out of the way and continued their home visits to provide infant young child feeding practices and counseling and providing cash assistance and delivery of kind services. So disruption in services were restored immediately just because India had the system already in place using technology. They had cadre of community workers which came to immediately of the rescue, and they were supported in several possible ways, like I said, through pension program and health insurance program and Ayushman Bharat, which is one of the largest health program which provided health benefits to all the workers and also other community people who were affected during COVID-19 because of the certain situation. The Aadhaar link biometric, using biometric transfer of cash assistance has been one of the greatest example of India's technology flagship, which has also been a game changing and has been used by India now delivering one of the major flagship of maternity benefit, Prime Pradhan Mantri Matritva Vandana Yojana, which is called PMVVY, and they are using dashboard to enhance the coverage, which within 2 months has reached from 30% till 2019 to now claimed to be 90%. I would like to conclude saying that India has a way, India has a potential to lead the world in terms of integrated response to social protection for nutrition because of its legal framework, because of its policy framework, because of its financing architecture. What we as UNICEF perhaps needs to continue to engage to mobilize and accelerate political will of different ministries of coming together and bringing more harmonized financing of government resources and public resources, but also of the ODA, whatever little bit percentage it is, to bring together to really reach every child and every person and every woman the last mile. I'll be happy to address anything in specific, but thank you very much for the opportunity and glad to contribute in whichever way possible. Thanks a lot to each one of
Thank
you.
you so much,
And thanks to
Veena.
Emily.
I think you have in fact touched on all of the 3 questions. So I'm not going to be asking any follow-up questions. In the interest of time, I think we will jump into Q&A. So please also make sure if you have questions from Veena to put them into the chat. Thank you very much.
Thank you very much. We're going to open this up for any questions. We have just a few minutes. I thought I would start it off with a question for Victor, which was really following up on some of the comments that Abby made, how the Nutrition for Growth Summit is providing opportunities for new investment commitments. But given the challenges of climate change and the findings of the report, what other key recommendations informing the commitments would you make at this important summit? And maybe I could ask all the panel members to turn on their cameras, please. So Victor, that question was for you. If you're still here. Okay, I'm not sure if I know Victor had to leave for another commitment. Let me ask a follow-up question on climate change, how climate change impact would be addressed along the community resilience pathway. And I guess that would be a question both for Abby and maybe anyone from the country panel. So Patricia, Vera, Amanita, could you please turn on your cameras, please? Abby, maybe you could address that, in particular, the climate change impact and the importance of community empowerment.
Yeah, sure. I mean, ultimately, I think that enabling communities to really kind of have solutions or approaches that they're able to take to be able to kind of deal with the impacts of climate change is absolutely fundamental. You know, we know through the localization agenda that we're ensuring that we have community platforms, community structures that can better deal with shocks and crises where people live is going to be a much more empowering and effective and efficient way for us to actually deal with these crises. I think it's also one of those areas that can be a lot more complex in terms of securing the levels and nature of funding and resourcing needed to be able to ensure that we can actually do this in a really sustained manner. And also ensuring that we can build out best practice and learning across the community. Just as I highlighted for some of the issues around local food solutions, there's a lot of different types of initiatives in this space. And so good practice it can be a lot more complex to make sure we're passing across from different contexts. So I think there's a really important need in the nutrition community to really think about building experiences around working with communities and community platforms more broadly, including in relation to how we support, empower communities to be able to manage in the face of climate crises.
Thank you. Ms. Amanita, perhaps you could address that from your perspective. And in particular, there was a question we want to note that it's been one of the hottest years on record, following up what last year was one of the hottest years on records. So is there a lesson from Sierra Leone's COVID response that could be applied to responding to these extreme weather events, which are likely to become more frequent? So Ms. Amanita, if you could turn your camera on and your audio. We seem to be having some technical difficulties today. Actually, we're just about wrapping up here. We're just about out of time. So apology that we couldn't take any more questions. We will make this recording available. And I want to thank the partners and the fellow authors of this report for their work developing this important report. I want to thank the speakers on their encouraging examples of how countries have successfully strengthened the systems that safeguard nutrition. Additionally, I want to thank both Global Affairs Canada and CIF for their crucial support. But most of all, thanks to all of you who are able to join this webinar. And a reminder, we have a link to the full report in the chat. Thank you so much for joining this session.
Well,